Hello guys, so now we shall be discussing regarding the interpeduncular fossa. Okay, so what is interpeduncular fossa? What are the contents of interpeduncular fossa, right? What are the borders of interpeduncular fossa? So all these things we shall be discussing right now. Okay, so we will discuss a topic of interpeduncular fossa. Now regarding this interpeduncular fossa, what are the important things you need to know? First of all, let me draw the lateral surface of your cerebral hemispheres, midbrain, pons, medulla oblongata and spinal cord, and then I'll explain you where is this interpeduncular fossa present. So just look at this picture over here. Let us say that this is your cerebral hemisphere. Okay, and here you have got your midbrain. So this is your midbrain over here. Now after this midbrain, the next important structure you have got over here is your pons. So this is your pons. Okay. Now after this pons, the next important structure you have got over here is your medulla oblongata. Now just beneath your medulla oblongata, continuing down, here you have got your spinal cord. This is your spinal cord. Okay. And all of you should know that on the back side here you have got your cerebellum. This is your cerebellum. Now where is this interpeduncular fossa? See, all of you look here guys, all of you should know that this is your cerebral hemisphere, right? So this is your cerebral hemisphere. This is your cerebral hemisphere, right? And can I also tell you that this particular part which I am highlighting right now, this is called as the base of the cerebral hemisphere, right? And second important thing is that all of you know that this part is called as the midbrain. This part is called as a midbrain. Now can I, one more thing I am highlighting over here and telling you, can I call this as the anterior part of the midbrain, right? So between the base of the cerebral hemisphere and the anterior part of the midbrain, here you have got a triangular area, right? So this triangular area over here is what is called as your interpeduncular fossa. Okay, so this triangular area which is located below the cerebral hemisphere and in front of the midbrain is called as interpeduncular fossa. There is one more important terminology called as interpeduncular cistern. What is this interpeduncular system? We will discuss in a minute, but for now what you need to know that this particular thing is your interpeduncular fossa. This particular thing over here is called as your interpeduncular fossa. Now let us see what is interpeduncular cistern. What do you call, why do you call a specific thing as a cistern? What does cistern exactly mean? We'll discuss that. So what we'll do is that we'll draw the same picture over here and then we'll discuss what is this cistern. So let us say that this is your cerebral hemisphere. This is your cerebral hemisphere all over here. And next all of you know that here you have got your midbrain, right? And after that you have got your, let us say this is your spinal cord over here. Okay, see this is your this is your pons, I'm sorry, this is your pons. And after the pons, the next important structure you have got is a medulla oblongata, and hanging down you have got this particular thing called as spinal cord. And back of this here whatever you have is your cerebellum. Okay, right. Next important thing is that all of you know what is the meninges that are covering your brain. We have discussed a separate lecture on the meninges, right? So in this topic of meninges, we discussed that let us say this is a red color line that is very closely attached to the surface of your cerebral hemisphere. Now can anyone tell what is this particular line which I am drawing right now, which is very closely attached to the surface of the cerebral hemisphere? Is this what is this layer called as? Is this called as dura mater or arachnoid matter or pia mater? Yes, this particular thing which I have drawn right now is called as your pia mater. Now after the pia mater, the next layer which you have got is called as a arachnoid matter. So let us see where is this arachnoid matter. You see this structure which I am drawing right now, this blue color line which I am drawing right now, right? This is your arachnoid matter. This is your arachnoid matter. Now when you are looking at this arachnoid matter, few important things you need to understand over here. What are these few important things? See, few important things are, for example, let us say that if you very clearly observe, can you see there is some space here? the space that is present beneath the arachnoid membrane, right? This blue color layer is called as the arachnoid membrane. Now just beneath this arachnoid membrane, you see this particular space that is located beneath the arachnoid membrane. Can I call it as subarachnoid space? This is called as subarachnoid space. And by the way, one more important thing that I have to tell you is that subarachnoid space is containing your CSF, right? And within the subarachnoid space there is arterial system called as circle of Willis. Circle of Willis is literally floating within the subarachnoid space, right? Sometimes the CSF is blood stained. Why the CSF is blood stained? Because if the arteries within this subarachnoid space rupture, the blood will be drained into the CSF, right? I'll tell about that in a minute. But anyways, that is not important right now because I've talked about that in a separate lecture, but still I'll revise those things right now. So but what is important here is that the space which you can see over here is called as subarachnoid space, right? Now there are some places where the subarachnoid space has left more wider gaps, okay? For example, if you can look at the picture over here, you see, if you can look at the picture over here, you see the subarachnoid space has left a wider gap over here, a triangular shaped wider gap. If you see here also the subarachnoid space left a wider gap, and on the back I have already drawn a wider gap there. So how many wider gaps are there over here right now? In this picture there are 3 wider gaps, okay? So wide gaps of subarachnoid space is nothing but called as cistern. What is cistern? Cistern is nothing but the wider spaces, wider gaps, or let me write it as gaps, wider gaps of subarachnoid space. Wider gaps of subarachnoid space is nothing but called as cistern, is nothing but called as a cistern, okay? So the wider gaps of the subarachnoid space is nothing but called as your cistern. Now here we have got 3 different types of cisterns. What are the 3 different types of cisterns which you have? So this cistern which is located is what is called as your interpeduncular cistern. Interpeduncular cistern, okay? So this particular cistern, whatever you can see over here, is called as your interpeduncular cistern, right? Now after this interpeduncular cistern, you can also see another cistern that is located just beneath this. And where is this cistern located? This cistern is located in front of the pons. So that is why this cistern is called as cisterna pontis. This cistern is called as cisterna pontis. Third important thing is that you can look at a cistern that is located in between. See, where is it located? So this cistern is particularly located in between. This is your cerebellum and this is your medulla oblongata. So this cistern is present between cerebellum and medulla oblongata. Can I call it a cerebellomedullary cistern? Yes. So this cistern is called as cerebellomedullary cistern. This cistern is called as cerebellomedullary cistern. So how many cisterns do we have, guys? We have got namely 3 important cisterns. One cistern I have already mentioned, that is called as interpeduncular cistern. And the next important cistern you have got is a cisterna pontis, and the third important cistern over here is cerebellomedullary cistern. So these are the 3 different types of cisterns which you basically have. Okay. Now what we shall do is that in another view of the brain we shall see from where does this interpeduncular cistern start. Now can you tell me, just by looking at this, from where does the interpeduncular start and where it ends? You cannot tell it because the structures are more vague over here, right? You just know that interpeduncular cistern is present at the base of the brain and it is also present in front of the midbrain, right? So but exactly what structures is it covering and all, so clearly you cannot tell what all structures it is crossing and going. So if I ask you what is the starting point of interpeduncular cistern and what is the ending point, it will be very difficult in this picture to tell what is the starting and ending point. So what we will do is that I will draw the inferior surface of the brain, right? And then I will explain you what are the structures that are interpeduncular cistern is starting from which structure and it ends at which structure. All these things we shall discuss right now. Okay, so let us look at the inferior surface of the brain. Now, I hope this picture all of you are aware, because I have drawn this a couple of times. So this is the brain from the lower aspect, and all of you are pretty sure that here you have got this structure over here called as olfactory bulb, and continuing to the olfactory bulb you have got olfactory tract. Okay, now another important thing over here is olfactory bulb, olfactory tract, and this part over is called as striae. I will discuss about this in detail in a minute, but you even have olfactory bulb over here. This is your olfactory tract and this is your striae. There are actually three striae like this. One is called lateral striae, medial striae and intermediate striae. We will discuss about that anyways. Second important thing is that here you have got this structure which I am drawing right now is called as your optic nerve on the right side, and this structure over here is called as your optic nerve on the left side. Both the optic nerves partially decussate each other, right? So they partially decussate each other and this is how they are formed. This is how they are formed, right? Next, just behind this, what is the structure you have got in the previous lectures? If you remember, I have discussed these structures previously, right? So what are the structures? First you have got over here, what is this? Optic chiasm, right? Behind optic chiasm, what is this Y-shaped junction? This is called as tuber cinereum, right? So let us look at where is tuber cinereum over here. So where is optic chiasm? The center point over here is called as optic chiasm. Just behind optic chiasm, you should have something called as tuber cinereum, right? So this part, this particular part is called as your tuber cinereum. Okay. Now from this picture previously, behind the tuber cinereum, what is another structure you have got? Behind the tuber cinereum, I have got this red color structure called as mammillary body, and behind this mammillary body, I have got such perforated region called as posterior perforated substance, right? So let us go forward here. Let us see what are the structures that are located. So here I have got two mammillary bodies. You see there are two mammillary bodies, right? And after that I have got what substance? Posterior perforated substance. See, this is your posterior perforated substance. Okay, and behind the posterior perforated substance, what is the structure here I have? See, this is posterior perforated substance. Behind this I have got this structure. What is this? This is your midbrain. Okay, so let us write that thing over here. Behind the posterior perforated substance, this structure which I have right over here is called as your midbrain. Okay, this structure over here is called as your midbrain. Clear? So this structure over here is called as your midbrain. So this is your midbrain. Now another important thing is that if this is a midbrain, then why did you draw like this and there is another thing like this? What are these two? These two are called as crus cerebri. This is called as the right crus cerebrus of the midbrain and this is called as the left crus cerebri of the midbrain. Okay, so this is your midbrain. Now after the midbrain, what do you have? Pons or medulla oblongata? You have got pons. So let us say this is the pons which you have got. This is the pons. After the pons, what do you have? You have got your medulla oblongata. So this particular structure over here is your medulla oblongata which you have over here, right? And by the way, you have drawn cerebral hemispheres. Where are the cerebral hemispheres? See, this entire thing is the right half of the cerebral hemisphere. On the other side is the left half. Then where is the cerebellum over here? Look here now, this is your cerebellum. So let me rub this picture out a little bit. And second important thing is that, so this particular structure which I am drawing right now, right? So this particular structure which I am drawing right now is your cerebral hemisphere. So these are your cerebral hemispheres. Okay, so this is your cerebral hemisphere over here. Now let us first label these things and then we shall discuss what are the structures that are located, right? So I hope all of you know that this particular part is called as your olfactory bulb. This is called as your olfactory bulb, and after that this particular part over here is called as your olfactory tract. This is called as your olfactory tract, and after this olfactory tract, and this one is called as your optic nerve. So one is on the right side, so you call it as right optic nerve, on the left side left optic nerve. Now where both these optic nerves are joining, this center point whatever is there here, this is called as optic chiasma. So this particular thing is called as optic chiasma. Okay. Now behind this optic chiasma, this pink body which you can see over here, this is called as tuber cinereum. Tuber cinereum. And behind that, these two bodies which you can see, one on the right and one on the left, these are called as mammillary bodies. Mammillary bodies. And behind the mammillary bodies, this particular thing over here is called as your posterior perforated substance. Posterior perforated substance. Okay. And this is your midbrain, and midbrain, what did I tell you? This is called as the right crus cerebri of midbrain. Okay. And this one over here is called as your left crus cerebri of your midbrain. And by the way, this point over here is called as your pons. This is your pons. And finally, this one is your medulla oblongata. Medulla oblongata. Right. Now, from where does the interpeduncular fossa start and where does it end? So just look at the line which I am drawing here. Interpeduncular fossa starts all the way from the optic chiasm. You see here, midpoint of optic chiasm. Optic chiasm itself is in the midpoint. So from the midpoint of optic chiasm, this interpeduncular fossa starts and it proceeds vertically downwards in this way till where it is proceeding vertically downward. So this is not vertical, right? So let me make sure it is vertical. Yeah. So it is proceeding from the midpoint over here, midpoint of optic chiasm. This interpeduncular fossa all the way extends down till the midpoint of the superior surface of the pons. So pons has got two surfaces, right? What are the two surfaces of the pons? See, this green color one which I am highlighting right now is called as the superior surface of the pons, right? And next, let us say with the red color thing which I am highlighting right now is called as the inferior surface of the pons. So pons has got a superior surface and inferior surface. And if you look at this, what is this? If you look at this particular interpeduncular cistern, this interpeduncular cistern, it starts from the midpoint of optic chiasm and it comes down all the way, it extends down till the midpoint. See, it is in the midline, in the midpoint. It is in the midpoint of what? Midpoint of the superior surface of the pons. So this particular thing, whatever I have written here, drawn here, this particular thing is the supra-interpeduncular fossa. Okay, this is your interpeduncular fossa. Now what we shall do is that we shall write down the things which we have spoken over here. What are the parts of the interpeduncular fossa? What are the structures that are located lateral as well as medial? Okay, so let us write it down. So the first important thing I have to write it down over here is that this interpeduncular fossa extends from the midpoint of optic chiasma, till where does it extend? Till it extends till the midpoint of the upper surface of the pons. Till the midpoint of the upper border of the pons. Till the midpoint of the upper border of the pons. So till here this will extend all the way, right? So interpeduncular fossa starts from the midpoint of optic chiasm till the midpoint of the upper border of the pons. Now what we shall do is that we shall discuss about the boundaries. Now what are the different kinds of boundaries do we have? Now what are the different kinds of boundaries do we have? First important boundary, if you can see over here, right? So let me draw this picture like this and you can figure out the boundaries. Now all of you just look at the picture, right? So isn't it in the form of a diamond shaped over here? You see, Isn't it in the form of a diamond shaped? Right, in this diamond shaped structure, what are the different things which you can see? First thing I can see is that this is called as the anterior boundary, this is called as a posterior boundary, and these two are called as the anterolateral. Yes or no? See, let me name it. This is called as the anterior boundary, this is called as a posterior boundary. This is called as an anterolateral, this is also called as an anterolateral. And down here this is called as a posterolateral, this is also called as a posterolateral. So now we shall discuss what is the anterior boundary and what is a posterior boundary. Anterolaterally what do we have and posterolaterally what do we have. Okay, so first we shall write down those names. Anteriorly what do we have? Anterolaterally what do we have? Posterolaterally what do we have? And finally posteriorly what do we have? Posteriorly what do you have? So what are the structures that are located anteriorly? Anteriorly in the sense, all of you look here, anteriorly in the sense on the top, yes or no? See, this is the anterior part. Now anteriorly on the top, what do you have? What is this? This is called as your optic chiasma, right? So can I write that anteriorly it is having what? Anteriorly it is having optic chiasma. Anteriorly it is having optic chiasma. Now after anteriorly it is having optic chiasma, anterolaterally what is it having? See, if this is a diamond shaped over here, this is the anterior part, then this will become anterolateral, this will become anterolateral. So anterolaterally what are these two structures over here? These two structures over here are called as optic tracts. Okay, remember one thing, this is optic nerve, this is also optic nerve, both of them joined together, the center point over here is called as optic chiasma. Next, this is called as optic tract, this is also called as optic tract. So anterolaterally what do I have? Optic tracts. Anterolaterally I have got optic tracts. Now after anterolaterally, posterolaterally, so again I am drawing the diamond shaped, all of you look here now. So if this is a diamond shape like this, right, so let me use another sketch. Yeah, if this is a diamond shaped in this way, this is anterolateral, this is anterolateral, this is posterolateral, this is posterolateral. So posterolaterally what do I have? Posterolaterally I have got, on one side I have got the right crus cerebri of the midbrain, on the other side I have got the left crus cerebri of the midbrain, right? So posterolaterally I have got what? I have got right and left crus cerebri of the midbrain. I have got right and left crus cerebri of midbrain, right and left crus cerebri of the midbrain. Posteriorly what do you have? So if again I draw the diamond shaped here, so this is a diamond shape like this, right? Anteriorly what do I have? Anteriorly what did I tell you? Anteriorly I told you that we have got optic chiasma. So if this is a diamond shaped here, then posteriorly what do I have? I have got what? The midpoint of the superior surface of the pons, right? Posteriorly I have got the midpoint of the superior surface of the pons. So posteriorly I have got the mid part of the upper border of pons. Upper border of pons. So these are the boundaries of interpeduncular fossa. So first important thing you need to know, from where does interpeduncular fossa start and where does it end? It starts from the optic chiasm and down all the way it ends at the mid part of the upper border of the pons. So what is the anterior part, what is the posterior part, anterolaterally and posterolaterally, what are the borders you have to know. Now what we shall discuss is that we shall discuss what are the structures that are forming the floor of interpeduncular fossa. What are the structures that are forming the floor of interpeduncular fossa? Now where is the floor? Where is the floor in the sense? For example, this is the midline which I have drawn. Now this midline is touching what all structures and going back. From the optic chiasm, this midline is touching some structures and going all the way till the pons. What all structures it is touching, those become the floor. For example, First important thing, it started from the midpoint of optic chiasm. Okay, that midpoint is the point which we made it in our mind, right? That is an imaginary point, that is not a structure, right? So the center point we call it as a midpoint. But as this line is coming down, it is touching the second important thing. What is this? Tuber cinereum. As the line is coming down, is it touching the mammary bodies? No. So we are not including them. As we are coming down, it is touching the posterior perforated substance. Yes. And next, as this line is coming down, what all structures it is coming nearer to are the structures of the floor. For example, first it starts from the optic chiasm. Down as it is coming down, floor is consisting of what? The floor is consisting of tuber cinereum. Now as the line is coming down, on the right and on the left we have got mammary bodies, and still as the line is coming down, we have got posterior perforated substance, and finally as the line is coming down, we have touched what? The superior surface of the pons. So exactly speaking, what are the structures that it is coming nearer to? All the structures that it is coming nearer to is, the first is the tuber cinereum, and the second structure where the line is passing nearer to is the mammillary bodies, and the third structure where the line is passing nearer to is the posterior perforated substance. Okay, so these are the three important structures where this line is passing through, right? So let us write it down. Floor is consisting of three important things. One is called as tuber cinereum. Second is called as mammillary bodies. Third important thing is called as posterior perforated substance. Posterior perforated substance, tuber cinereum, mammillary bodies, and posterior perforated substance, right? So these are the structures which you need to know over here. So we discussed the boundaries, we even discussed the floor of interpeduncular fossa. Now we will discuss about the contents. So what are the different contents of interpeduncular fossa? What are the different contents of interpeduncular fossa? So what will you tell? What are the contents of interpeduncular fossa? Interpeduncular fossa is having one content, that is called as interpeduncular cistern. You know what is cistern now, right? It is having interpeduncular cistern, and this interpeduncular cistern is having one important part, that is called as circle of Willis. I will tell you what is circle of Willis right now. I'll just give you a brief introduction of what is circle of Willis. Later on I will have a very detailed discussion on that. But for now, what you need to know, that what is the content of interpeduncular fossa? Interpeduncular fossa is having interpeduncular cistern, and this cistern is in turn having circle of Willis. So what is this circle of Willis? What is this circle of Willis? What is this circle of Willis? Is that circle of Willis is a group of blood vessels that join together to form a circle, right? And this is called as a Willis circle, and this mainly supplies to your brain from the front all the way, from the frontal region till the occipital region. Everywhere it supplies to your brain. And where is this circle of Willis present? It is present in the subarachnoid space. Okay. Now this circle of Willis, how do you draw this circle of Willis? The first important thing is that, just look here, this artery which I am drawing right now, is called as right vertebral artery. Why it is called right vertebral artery? Because it passes through the vertebral, through the transverse foramina. You know, vertebra has got transverse process, all of you know. Transverse process has got transverse foramina. Through this transverse foramina, this vertebra ascends up. For example, let us say this is your vertebra. Just a rough picture, okay? This is your vertebra. Okay, this is your vertebra. Now all of you know that vertebra is having a body like this, and it is also having a spinous process in this way, and it is also having a transverse process like this. On other side also there is a transverse process. Now within this transverse process there is a small opening called as transverse foramina. Now what I am telling you is, this artery which I am drawing right now, this artery goes up, it comes out of transverse foramina in this way. So this artery over here is called as vertebral artery. Okay, so one we have on the right side, so right vertebral artery, and the other vertebral artery we have got on the left side like this. This is called as left vertebral artery. Okay, so this right and left vertebral artery, both of them, they join together to form another artery, a single artery like this. This artery which is formed is called as basilar artery. Okay, you see the right and the left vertebral artery join together to form basilar artery. So let me draw it down over here, right. So the right and the left vertebral artery join together to form this particular artery called as basilar artery. Now this basilar artery will give out two branches like this, one branch onto the right, one branch onto the left, one branch onto the right and one branch onto the left. So this branch which is given on the right is called as posterior cerebral artery. What is this artery? Posterior cerebral artery, which is on the right, so you call it as right posterior cerebral artery. Okay, so this is your right vertebral artery, this is your left vertebral artery. Right and left vertebral artery together join to form this artery called as basilar artery. Basilar artery. This basilar artery will divide into two branches. One is called as the right cerebral artery. This is called as the left cerebral artery. Right and left cerebral artery. Now let us leave this discussion over here. Let us discuss about another arterial supply. Let us say that this artery which I am drawing right now on both the sides, right? So this artery is called as internal carotid artery. One is called as the right internal carotid artery, another one is called as the left internal carotid artery. Okay. Now, what is happening here? From this internal carotid artery, you see two branches that are coming out. See here, from this internal carotid artery, you see two branches are coming out like this. You know what these two branches are called as? These two branches which are coming out here is called as, see, this is right cerebral artery, right? And this is also cerebral artery. What is the name of this artery? This artery is also cerebral artery, but one is on the right, so I can call it as right cerebral artery. Now you might get confused why there are two names of same arteries, right cerebral artery, and this one is called as your left cerebral artery. Cerebral artery. Now tell me, out of these two arteries, which is on the back? The arteries which are on the back are this one, right? So I have to call it as right posterior cerebral artery, left posterior cerebral artery. Now this is in the middle, so you call it as right middle cerebral artery, left middle cerebral artery. Now you are telling it is middle, it means there should also be some artery which is anterior cerebral artery, right? So there are three cerebral arteries. One we have got is an anterior cerebral artery. This is called as a middle cerebral artery. Another one, this one which I have already drawn, is called as a posterior cerebral artery. So there are three different types of cerebral arteries. Okay, right. Next important thing is that from this internal carotid artery, there is another artery that is going up like this, right, to the anterior side. So this artery which is going on to the anterior side is called as your anterior cerebral artery. Okay. Now, what is our job? What is our job is that, see, this pink color arteries, let me name this. This is your anterior cerebral artery. So one is on the right, so right anterior cerebral, left anterior cerebral. So what is my job is that I have to connect the pink color blood vascular system with the red color blood vascular system. How will I connect? I will connect with this help of special arteries called as communicating arteries. Okay, there are two communicating arteries. All of you look here. One communicating artery is present in between two anterior cerebral arteries. Next communicating artery is present between the middle cerebral artery all the way till the posterior cerebral artery like this. Okay, so these are the two communicating arteries which I have got. Okay, so what are these? See, with the help of these communicating arteries, have I joined all these structures? Yes or no? And you can also very clearly see that there is a circle, right? So there are two important arteries over here. What are these two important arteries? You can very clearly see that connecting these two anterior cerebral arteries, there is an artery like this, right? Now connecting the middle cerebral artery with the posterior cerebral artery also, there is an artery all the way like this, right? So there are two important arteries, and you can also see that there is a circle that is formed here. This circle is called as circle of Willis. Okay, what is this circle called as? This circle is called as circle of Willis, right? Now important thing is that what are these arteries called as? These arteries are called as anterior communicating artery. Anterior communicating artery, and this arteries which are located on the back are called as posterior communicating artery. So anterior communicating arteries, and next important thing is posterior communicating arteries. So all of them together they join to form this circle over here. This is called as circle of Willis, right? This is called as circle of Willis. And where is this circle of Willis present? This circle of Willis is present within your interpeduncular fossa. Okay. So what are the things that we have just discussed over here, guys? We have discussed that this triangular shaped depression which is present, right? Where is this triangular shaped depression that is present over here? This triangular shaped depression is present in between the inferior surface of the cerebral hemisphere and in front of your midbrain. So this is called as interpeduncular fossa. Next important thing is that within this interpeduncular fossa we have got a cistern, so you call it as interpeduncular cistern. Cisterns are nothing but the gaps of the subarachnoid spaces. So three cisterns we have got: interpeduncular cistern, cisterna pontis, and cerebromedullary cistern. So here where is interpeduncular fossa? Interpeduncular fossa all the way starts from the optic chiasm down all the way till the superior midpoint of the superior border of your pons. So till here it will start, till here it will end. Okay. Now what are the borders here? So these borders are in the form of a diamond shaped. The anterior border is optic chiasm. These two are anterolateral. Anterolateral is having what? Optic tract. Next we have got posterolateral here. Posterolateral is having what? One is called as the right crus cerebri of the midbrain, left crus cerebri of the midbrain. And posteriorly what do we have? This point that is called as a midpoint of the top surface of, or the superior surface or the upper part of the pons. Okay. So these are some of the very important things which you need to know regarding the interpeduncular fossa, guys. So thank you so much for watching my video. Goodbye.